Thanks to the programming committee and IOEN for having me here today. So my name is Mike Ast from HSS. I don't know if you know this, but Dr. Abdel and Dr. Meneghini take timing very, very, very seriously. So I'm going to ask you to start the timer so I don't get in trouble, but also be very aware that I'm from New York and I can speak extraordinarily quickly. So even though I have 743 slides in this talk, I'm going to be done in 3.5 minutes. So I'm going to talk a little about handheld navigation and why it's perfect for the ASC. And I think what we're going to hear over and over again today is that a lot of the technologies work. There's a lot of really great technologies out there. Each of them have their pros and cons. The understanding is what's different about a hospital than an ASC, and what's different about a patient in an ASC that might be different than the patient in the hospital, and how does that affect technology choices. So really, really, really super important disclosures here. I'm going to be specifically showing some pictures of a technology that I helped design, that I get royalties for, that I own a portion of the company. So very, very critically important that you understand that and take everything I say with that into account. So when we talk about joint replacement patients, I think Lenny kind of outlined the idea that we're doing a lot of them, there's a lot more to do, and we have to figure out ways to get better at doing them. But they're also different patients, right? Joint replacement patients, especially in the ASC, they're younger, they're more active, they're highly motivated, and you know what? They may even be falling into these new value-based care contracts, and all of this matters when we make our decisions. So the question is, for these patients, for all of our patients, but for these patients specifically, can technology answer the challenges we see? And Lenny showed this study, right? Computer navigation reduces the rate of revision in young patients, right? Specifically in patients under 65 getting primary total knees. It also decreases overall morbidity in that same patient population. So, right, this isn't our 80-year-old in the hospital that's going to be there for 3 days. We want young, healthy, active patients leaving our surgery centers in 4 to 6 hours, and we understand that navigation clearly provides a benefit to those patients in both the short, medium, and long term.